Okay, I'm recording.
Okay, this is body 69. It's a 1-year-old female, beautifully mummified, and we do have a little problem with getting to sample the internal organs. And so the new instrument we're about to try on this is an old-fashioned laryngoscope, fibre optic with a straight head. So you put it on like that. Helen, if you hold this up, we're going to put the laryngoscope down the either the tracheal or the esophageal opening. I can't even be certain which, but I have a feeling because it's open that it is the tracheal opening. And we're just going to look down there and using this equipment biopsy what we hope is a piece of pleura. It's just a matter of getting it in the right spot there. Okay, so just put it in the jar, and that's the biopsy. Oop, doesn't want to let go. Biopsy of a mummy. This is body S57. It's a newborn baby, and it's so newborn that if you look here carefully you will find that the umbilical cord is still attached and the string tying it off is still present. Now the question is, did this child die at childbirth, or did this society, which was a Christian society, practice leaving some children to die naturally after birth? It's more likely that the child died at childbirth. This is body S27, little child, a boy about 2, very well mummified except for the skull. We're just going to look inside because there is an entrance using the laryngoscope.
Excuse me for 1 minute. We need to get a bit more light.
Well, I turned it off because you have to wiggle it to make it come on. It does not very happy about coming on. You have to wiggle it around, and if you're lucky, it comes on. That's why I was annoyed with you when you turned it off, because I just got it to come on.
I turned it off?
No,
I didn't know.
Mark turned it off. If you look at it, that's it. If it comes on, I don't want it turned off again. Yeah.
Shit, I was recording it all.
You can wind it. Alright, so we're going in with the laryngoscope. I've got some nice views now and there, you know. And I can, with the biopsy forceps, biopsy the chest wall, maybe even go through the diaphragm into the abdomen. The diaphragm is fairly complete, but no, it's got a hole in it. Alright, that's all the biopsy we need. Thank you.
So it's a 42-year-old man.
Yep. I've just seen something very interesting.
Why is it flashing R?
Does that mean it's recording?
That's recording.
Uh-huh.
Yeah, this is body 1. You're doing
It's doing it.
S191. It's a 42-year-old male, and he has a number of very interesting pathological features which I have so far been able to discern. The most significant of which is this little fibula bone, which does look as though it may have had a fracture here in the past. It's obviously not complete, but it's got changes here on its anterior surface, which could be syphilitic. This is especially interesting for the very simple reason that this body was buried in 750 AD in the Sudan, and everybody feels that syphilis was brought from the New World by Christopher Columbus 750 years later or more. But there are other causes of this type of lesion which are related to syphilis and are caused by a similar organism, so it's not definite. Looking at the other bones, I cannot see evidence of changes elsewhere reminiscent of syphilis. I do have the other, or part of the other fibula, and it looks perfectly normal. I am trying to find the tibial bone, which would complement this, and I cannot find it at all here. I can find the arm bones, I can find everything except the tibia.
The teeth don't look syphilis.
The teeth don't look syphilitic, no. However, in my rummaging through, I managed to find this, which is the metatarsal of the left foot. And there's obviously been some sort of quite nasty infection in this region, causing the cuneiform and several of the other bones to collapse and fuse. Unfortunately, I can't find any other toe bones here that have lesions on them. There are foot bones in this thing, but the only lesions I can see are in fact on in this area. So one has to assume it's some sort of infection. Also, I note here that the hyoid bone, which is normally cartilage, has calcified, as has the thyroid cartilage. Oop. Oh God, it's going to be on video, we're going to edit that. And this is the man's Adam's apple actually showing up, so it's interesting. Okay, thank you. Body 90. I think we'll use the smaller head because the entrance to the body is very, very narrowed.
Do you want me to hold it?
Yes, please. It's quite fragile, actually. But interestingly, while it's mummified wholly on this side, on the underside, it's totally exposed. So we probably don't even need to use, let's have a look and see what's in there. The diaphragm is still in place. Isn't that interesting? How old is this child?
18 months.
A bit young for schistosoma.
Do you want me to hold it?
Yeah, we're just going to take a biopsy of the pleura if we can, but we can't because it's... I'll just get a cutting scissors.
Right, the scissors are there, or my little ones are over there.
Where are the scissors?
Those are the scissors.
No, they're not the scissors.
The next one. The next one.
So we'll use the biopsy scissors posteriorly. It's tough material.
I'm taking.
This is a 42-year-old woman, Helen.
Yeah.
She is mummified but has been disarticulated. This is the pelvis, and we are going to look inside the pelvis because the anterior abdominal wall has collapsed on the pelvis. And so we're going to have the opportunity This wretched thing never works. That's better. With the laryngoscope to go inside. Helen, can I have your... I'm going to try to sample around the area of the bladder, because if you're going to go for bilharzia, bladder seems to be a good spot. I'm just pushing aside the anterior abdominal wall. We're inside now the pelvic cavity. You can't make out anything that looks like the bladder, but anatomically the bladder should be in this area. Can we have somewhere to put these samples? Get one of those plates, one of those little plates things. That's very small, but we're still working our way around. Very dried up material, obviously, but this is probably bladder, posterior pelvic wall, whatever. So that's enough of that. We can in fact put that away. I'm going to change instruments, biopsy forceps. And now we're going to go into the chest cavity, which is not going to be that easy because the diaphragm has survived totally intact. See that?
There's just a little space there.
No. Do you know what that is?
No.
That's the aorta.
Really?
That's the room where the aorta ran. Now, how old was she?
42.
All right. Let me get some finer biopsy forceps because we're going to...
Can't we go in from the top?
No, we're going to sample the aorta and do a little bit of histology on it later and see if she had any heart disease, any artery disease. Now with their diet, I can't imagine them having excessive cholesterol. Get me another. So when you get that, label it arterial wall, and we'll get some histology done on it, just for the heck of it. All right, we can leave that, and now we'll try going in from the top. But once more, the top, there isn't any room, you see.
Where's that in there?
Through there, no, it gets stuck. I think we'll go in through the bottom.
There's a hole there.
Yeah, I'm going to get the finer instrument.
See there?
Yep.
Don't make it bigger.
Okay, this is pleura.
Is this more of the same?
Yeah, this is pleura as well. And this is from the left. I'm going to try to get it left and right.
Are you changing that?
If I can get across to the other side, it's...
That's right, is it?
No, this is still left, but I've now managed to enter the right lung cavity. That's right lung cavity. This is pretty good, you know, it works.
The only thing is you're damaging the diaphragm.
Okay, that's it. That's the right. Okay, let's put this down now. Now it's 168. Who is it again? It's a
47-year-old man.
man. A couple of interesting features. The right eye is beautifully preserved. You can actually see it. He's bearded. You can see his beard. It's partly grey but blondie. Now we are going to biopsy the inside of his chest cavity, and I can look down in there with the laryngoscope. The left diaphragm is fully preserved, the right diaphragm has been torn, and I'm now going to biopsy from the right and left pleural cavity. Okay, thank you.
Okay, so
This is body R19, 37-year-old man. There is some mummification. It's obviously disarticulated and mainly skeletalized, but for instance that's a hand and it's quite well articulated. Pelvis, as you can see, is totally skeletalized. What we're looking at is two things. We always examine the spine in case there's any evidence of infection. I'm just putting the bones back. Now, at some time in the past, somebody did do quite extensive work on bone metabolism on these people, as a result of which we have femurs and humeri. Their heads have been cut like this. Now, we're very interested in getting some of the insides of the bone, because this is where the blood vessels are, and particularly because we're going to do schistosomiasis, we'd like some, what's the name?
Leishmania, not schistosomiasis.
Go back, please. No, you have to go back. When they do this, they expose what we hope is part of the bone marrow, either at the head of the humerus or femur. Interestingly, this guy has got some very thick cortical bones. These are very solid bones. Some of the women we see, this is so thin that it's a millimetre thin. And you look at this man and he has a very solid amount of bone. He's also from the R symmetry, which to me seems a bit richer than the S because the bones are stiffer.
Yes.
So how do we get the marrow out? We get one of these, and then using a dental pick but in this case life's been made very much easier by the fact that the marrow has been exposed. You can see it's not elegant, but it's very functional. And as you can see, we are literally not damaging any of the external appearance of the bone any more than it's already been damaged. I may point out I'm using a dental pick, but in some cases I'm using one of my favourite instruments, a paper clip pulled out. Also does the job. But in these cases, because the bone has been cut and cut again, it's much easier with the dental clip. Pick. And that's it, that's all we do.
Okay.
These are two examples of mummified infants, and as you can see, there is a difference in the nutrition between 110 and 111. Whether this is a reflection of status or of disease is something our research will hopefully determine. Sorry.
No, never mind.
Okay, we're now going to sample mummy number 193. This is not well mummified, but there are some features of mummification left. So we have the spine and the right thoracic cage. We have the skull, which is mummified. So are some of the limb bones, but not all. There's an arm that's mummified here, but we're not going to do anything with that. There are the ribs, where we are sampling. And for a previous experiment done on these mummies, other people had taken and sewn some of the long bones in half. We're interested in bone marrow because of the thought that there may be calaza here, calaza. So we're going to take and sample the insides of these previously sewn bones. I'm in a way very grateful that they have done that, because I certainly wouldn't be sewing bones in half for bone marrow. Of course, with a person of this age, and how old are they, Helen?
37. Woman of 37.
It's a woman of 37. Terrible teeth, look. She's virtually lost all her molars, premolars and canines on the lower, and she's probably only got 1 or 2 molars in the upper. And the one I can see, the third left, has got a hole in it that drove a truck through. So it's not a very good state of preservation of teeth. I'm just looking through here to see if there are any tissues we may want to do. And interestingly enough, I can see the thyroid cartilage has been preserved and it's still here. So, but I'm not going to sample that, I'm going to put that back. So we are going now to sample the bone marrow of this patient. To do this, we're using a dental scraper or pick, and we're just sampling here. Of course, in a young child, we'd be 100% assured of getting a very nice piece of bone marrow. In an adult it's not so certain, but we're certainly getting something out of here into the box like this. The whole aim of this work is not to damage anything, visually, and that destroy the integrity of the... So this one is a bit too long for the dental pick, so we in fact do a milkshake type procedure.
You're going all over the milk then.
Well, we've got a bit out. And just to, because we want the sand in this one. Who knows how it got there?
It's coming out of this end as well.
Anyway, we've got something which may or may not be bone marrow. It's certainly going to be a vascular situation, so we may get some useful data out of it. Let's hope. Now, in this situation, we have been sampling bits of rib. I've yet to see a 1200-year-old skeleton where there isn't a broken piece of rib present. And here we've got 2 bits of broken rib which we are going to take for further analysis. Now, here we have, I don't know where this came from, it would be useful if I knew where it came from, but we do have pleura, parietal pleura, which if there was tuberculosis may well contain the DNA, and we are going to sample the pleura. Once more, we're not sampling the intercostal bustles, we're just peeling the pleura off the rib, so there is no visual problems with the sample. And because we've got some bits of pelvic material, we are going to take a little bit of pelvis as well. And this is a typical biopsy situation for our Sudanese mummies. All these bits and pieces will be taken to the laboratory and analysed. Thank you.
Okay.
This is body 162. To me it looks like a female. I have no idea of her age, but she ain't young. She's not skeletalized, so we're having difficulty in aging her on the normal bony parameters. But she has mummified quite nicely. I'm now looking into the right chest, which is empty. The heart and diaphragm appear to have survived. Can I get to the right side? At the moment, no. So let's see what we can salvage through biopsy. Got a nice piece of right-sided upper pleura. New biopsy forceps. just, can you get me one of those? Because this will have to come out piecemeal, it's not easy. Yeah, can you just tip it off? But gotta be careful, this is tough tissue. We've already broken one of our biopsy forceps this morning. Now I've finally gotten through I think the pericardium actually, and what I'm biopsying is pericardium and heart tissue, sort of mummified tissue. Yes, thanks. Get past that into the and that's pleura. So get me a jar, that's it. I'll get you a bit more left pleura.
Oh, that didn't come off.
Opa. Just
Oh yeah, that looks like pleura.
that is definitely pleura. All right. That will do for the top. Look at the
So-
blonde hair. Will you have a look at the hair? I'll give you a little bit of hair to take. You can do metabolic studies on hair and estimate diets and things. Every now and then you do take that. Now we're going to look down in the pelvis. I'm just going to change heads. And of course, use biopsy forceps will be different as well. So can you give me a hand? Look, this is the pelvis. Hold it back like that. You really cannot tell what's what here, but you have a pretty good guess that if it's in front, it could in fact be bladder, and I'm certainly going to call this bladder. We'll split that in two. I may have taken partly the uterus, I'm not sure. I'm not willing to bet on that. No, there is. These look like fecaliths to me, so we'll take these two as well. Could be sand. Look, we're going to have to study it or get, under a microscope, but they're in the right spot. And now on posterior, and this could be bowel. So I think we'll leave 162 now, 160. The interesting thing about this one is that it is looking very cahectic. You can, unlike most of the others, it does seem to have a significant loss of weight. You can see the ribs, the sunken cheeks, even in mummification. Generally speaking, things don't look like that. But the hair is very nice, and we're not sure of the sex. Some people think it's female, but in those days, this sort of hair could well have been worn by young men. If you look at the left arm, you'll see that there is some evidence of the bandaging or netting they put on it. So originally this body would have been covered by this as a shroud.
No.
We're now going to start looking at the biopsy potential of this patient. Certainly I can get pleural.
Yeah, even I can see them.
There is some sort of black matter here. It could be soil, but it is in the chest wall. But what I'm pushing aside here, I believe, is the diaphragm. And just here there is an area which I would suspect is the heart.
Is that the same stuff?
Yes, that's from one side.
The left side.
When?
Okay, now we're going to do the right side biopsies.
Do you want me to hold it? Do you need me to lift it up? Or?
Not at the moment, because there was a piece sticking out there. Nice piece. Now I'll get you to lift it up a little bit, please.
Okay, let me just label. That was right.
Yes. Now, if you could lift this just a little, choose to look through here. Now, here I've got a diaphragm which is still complete, and it's actually flapping up and so obscuring vision. Hopefully, the laryngoscope will do its job and it'll flatten it down. Ah, there it is. Now this is mediastinal area. I'll get you a couple more bits. Just a minute. Okay.
This is the room where the mummies are, and on the right hand side we've got the mummies from the island cemetery known as the S cemetery, and on the right hand side we've got the cemetery of the village that was on the banks of the Nile, and we've almost finished sampling both of them now after a week's work. This is R203, so we'll take that next door to sample.
Okay, we have taken over 1,000 samples. We've sampled everything we could possibly think of in the mummies. We will probably have to come back because of some of the things we haven't thought of. We're leaving that behind. Here's our old trusty sample suitcase, which is loaded full of human bones, ribs, hair and marrow. Helen is taking it back to England, and we may have to come and bail her out for smuggling people's body parts, but we'll see.
Not your worry.
We're now cleaning up and closing up and saying farewell, University of Colorado. Okay, so we're ready to go. Here's the endoscopy gear, and here's the famous suitcase full of mummy samples. Who does the honours? We both are leaving. Hello world. Off we go.
Into the sunset. Bye!